health centers all around the US are getting their funding cut. The big beautiful bill signed by the Trump administration is going to take much of the funding away from the nonprofit community health centers that operate all over the United States. I spoke with Apicha Community Health Center to talk about how these cuts will affect their operations.
Our Manhattan clinic, where patients come and are being seen by our medical providers for primary care. So that means preventive, chronic care disease, and we also have a pharmacy in this building.
These community health centers, like Apicha, are getting their funding cut and they're not going to be able to operate the same way that they used to.
The cut in Medicaid is going to be affecting all community health centers. And all community health centers are really the place where people who are underserved and don't have all of the means go to and get all the quality care that's needed to manage chronic diseases and provide screening for issues that can prevent more serious diseases like cancer. You know, if staff and providers and doctors and nurses leave the community health center, it begins to then have a domino effect in what can be a much more severe health issues that we will be facing in a public context.
These funding cuts won't go into effect until 2026. And so many healthcare facilities all around the US are in a crisis mode. Wait, you can move to the, yeah. And so they don't know what's going to happen after these cuts go into effect. But they do know that they're going to have to source their funding from other sources, like from the private sector, to be able to make up that loss from the federal government subsidizing them. And you can't easily get that money from the private sector either. And so without the funding to be able to operate, they're not going to be able to provide this preventative care to their facilities. And many people won't know the effects of this until it's too late.